Okay, thank you very much for this excellent overview. Are there any questions from the audience? We have time for one short question. I have a question. In a patient with ARDS and a severe shunt that is hypoxemic, would you use inotropes to improve oxygenation as a kind of rescue strategy?
Yes.
Okay.
Yes, we do.
Even if your cardiac output is normal, would you go to supraphysiological levels?
Well, if the SVO2 is low, firstly, in those patients, we would certainly try to reduce the demand. We would also increase the hemoglobin to normal levels. I am not a believer of the Canadian HEBER study on the 70 grams per liter for everybody. I think it's nonsense.
So you would go to HB of 7 or 7.5 millimoles per liter?
Of PO2?
Hemoglobin?
Hemoglobin. We would go to 120.
Okay, so this.
I mean, normal hemoglobin. Why not? If you reanalyze the EBER data, actually, it shows that for patients with ischemic or hypoxemic conditions, actually low hemoglobin is bad. So, I mean, we would certainly go for that. And if still the SVO2 is low, so that we consider it critical with signs of other organ dysfunction, then we will set up with the inotropes.
Okay. Thank you. Okay, so there's another question. Yeah.
But talking about
1 second, wait for the microphone, please. Could we have a microphone?
I mean, let's not go into the talk about what is the right hemoglobin level, but you talked a lot about the evidence that it has to be there in order to step into the future. I mean, if you look at the hemoglobin levels and evidence and outcome relation to higher hemoglobin levels, your concept is not really supported by outcome data at all.
A quick answer, please.
I fully agree. If you have thought that I'm one of the evidence-based medicine people, you are dead wrong. I mean, the physiology is there, and I think when we don't have the evidence, we need to use the physiologic considerations. The problem I have is normally these physiologic aspects that I presented to you are not known or not used or not understood. And I think when we do something, we should at least remember the physiologic effects of our doings.